Okay, we're recording. So welcome, Tara and Faryn. Thanks so much for being with us, for accepting the invitation to talk more about what you're doing and how COVID is impacting that. Tara is from the Wyoming Coalition Against Domestic Violence and Sexual Assault. And I'll let you tell us a little bit more about how you came to that perhaps and how long you've been there, and then whatever else you want to tell us. And Faryn is at the SAFE project here in Laramie. And the same for you, Faryn, to hear kind of how you came to that and how long you've been in that role. And I think you all perhaps have chatted a bit maybe about how you want to do this, but welcome tonight and welcome everyone who has tuned in. Looks like the Hayneses are about to join us here. But thanks for joining us, and I look forward to this conversation. So who would like to start?
Can they hear you? Okay.
Mm-hmm.
Okay. Faryn, do you want to start?
Yeah.
Do you want to start?
Sure. Yeah, I can start. So my name is Faryn Babbit. I am the executive director of the Albany County SAFE Project. I grew up in and my parents grew up in Laramie, my grandparents grew up in Laramie, so I've been here a long time. I went to UW, and after college I started working at SAFE, and I was offered the executive director position in 2016. So I've been in this role for what year is it? 4 years. So I didn't plan a formal presentation. I kind of just wanted to talk to you about what we have seen in Albany County with trends for domestic violence, sexual assault, and stalking. And then I know that you're interested to hear how COVID has impacted our work. So if you have questions or anything like that, please feel free to interrupt me and ask. Oh, this is my dog, Marley.
Sounds like that.
I'm happy to answer them. So annually, I'll just give you kind of a little bit of background into what SAFE does for people who may not be as familiar. So SAFE Project is a nonprofit in Albany County. We've been a 501c3 since 1980. And we serve survivors of domestic violence, sexual violence, stalking, child abuse, and vulnerable adult abuse, which would include elder abuse. The vast majority of people that we work with are survivors of domestic violence, followed by sexual assault and then stalking. We also serve the campus community, so we're a pretty busy program. We annually serve upwards of 380 to 400 unduplicated people a year in Albany County. The majority of people that we serve are Albany County residents. Most of them live in the city limits. And we do serve about, I would say, 80 to 100 students a year, primarily sexual assault survivors. Most of the sexual assault victims in our community are college-aged women. We do serve male survivors of domestic violence. People often ask me if men are ever victims of domestic violence, and although you don't hear about it very often, they absolutely can be. And so SAFE Project does serve male survivors. We serve the LGBT community. We also work with trafficking victims. And yes, trafficking does happen in Laramie. People don't really think that it does, but it does. We have an emergency shelter. So that's probably what we're known for the most, is that we have a shelter. But we also, we provide a ton of other services that aren't specific to shelter, and the vast majority of clients we serve don't actually stay in our shelter. So we have a really big financial assistance program. We help our clients to pay for deposits, rent, utilities, childcare, medical bills, transportation costs, relocation assistance. We help them, really just, we want to get them back on their feet and get them get them safe and sustainable, whatever that might look like for them. We have 5 full-time advocates at Safe Project. One of them works full-time at the University of Wyoming with our campus population, and the others work in the office. We have a pretty big outreach program. So we have an outreach coordinator and a prevention coordinator. And our prevention coordinator works with K through 12 kids in the community. So we know that the best way to prevent violence is to start when children are young, right? Like we don't want to wait until they're 18 to start teaching them about healthy relationships and healthy boundaries and things like that. So we go into the schools from, even preschool sometimes and work with little kids all the way up to seniors in high school. So that is in a nutshell what Safe Project does. Does anyone have any questions about that before I keep going?
How do you
Wondering how
fund
many.
all that? How do you fund all of those services?
How do we fund that? So that's a good question. So our program is primarily funded by state and federal grants. So you've probably heard of the Violence Against Women Act, VAWA. That funds quite a bit of our program. Victim of Crime Act funds fund a lot of our program. And then we get a lot of funding from, well, I wouldn't say a lot. We get a small amount of funding from the city, the county, and the United Way of Albany County is a huge supporter of Safe Project, as well as a lot of other awesome nonprofits in the community. And I apply for funding every year from philanthropic organizations like the Mary Kay Foundation, the Guthrie Family Foundation. They are a huge supporter of us. And that's probably something that's been affected by COVID the most is our fundraising efforts. So every August, we have a big fundraiser at the Alice Hardy Stevens Center. It's called the Brunch and Bubbly, and it's a garden party. It's really fun. We usually have 200 people there. It sells out every year. We couldn't do it this year. So that that fundraiser last year we profited about $17,000 from that fundraiser. And so that's something we had to cancel this year because of COVID. And so we're trying to figure out, unique ways to fundraise virtually. I think people are really burnt out with Zoom stuff and online stuff. And so, trying to come up with a way to fundraise in a way that's safe for people has been a little bit of a challenge. And I do worry about the economic impact that COVID has had on all of our community supporters. We receive a lot of funding from people like you guys in Albany County, churches, private citizens who just want to support us. And, I'm not privy to, how Albany County has been affected specifically by COVID, but if it's, anything like our national trends are, then, I think we can expect that nonprofits might struggle a little bit. We might have some lean budget years ahead because of the economic impact of COVID. So I think that's probably how we've been affected the most.
Have you seen an upturn or a tick up with the number of cases?
So people, I think nationwide we have, right? Like nationwide, we know that if people are stuck at home with an abusive person, that we would expect that rates of domestic violence would increase pretty substantially. And I know that in meeting with other directors of programs like ours around the state, there have been programs that have gotten busier. Overall, Safe Project was pretty slow during the spring and through the summer. I meet every 6 weeks with our county attorney and our police department, as well as the sheriff's office and the university police. And overall, domestic violence, sexual assault, and stalking cases were fairly low. That's not to say that they were not happening. In fact, I always get a little bit concerned when cases are low, because that means that survivors are not able to seek services, because we know that it's happening. So sometimes when I say, oh, we haven't been that busy, people think that's a good thing, but it isn't. We want to be busy because we know that it's happening. Our shelter is currently full. It filled up pretty quickly after we reopened everything after June. So it's starting to feel a little more steady, and I suspect that as students start returning to campus, we'll get busier too, because we just always get busier when the students are here. So
do many of your people that you serve, do they have children?
quite a few. Yep, quite a few. We serve a lot of kids.
Be pre-kids or kids in school or all ages? All
ages, yeah. And right now we've got 4 kids in shelter with their moms. So yeah, we actually usually serve more kids in the summer because people feel like it's better to uproot things and move in the summer months than during the school year. They don't want their kids to have to leave school and switch schools. But yeah, a lot of our domestic violence clients have children because they're not super young women. A lot of them are, 25 to what I would say probably 55. So a lot of them do have kids. Yeah.
What's the tenure for someone going in the shelter? Is there a specified length of time that they can stay, or how do you evaluate that?
Yeah. So typically our shelter stay is up to 8 weeks. It used to be up to 30 days, but we were noticing that it's really difficult for someone to find a new job if they don't have one, find an apartment, get money to move, all of those things in a month. So we've extended that to 8 weeks, and then we can potentially extend people on a case-by-case basis depending on the situation. So
what's your capacity at the shelter?
So during normal times, our capacity is about 17 people. We have 17 beds in our shelter. Right now, our capacity has been minimized pretty significantly. So we have 3 apartments, and typically we do have like a roommates, clients will move multiple women into an apartment, but right now we're only doing 1 family or 1 woman per apartment, just to minimize the risk of spreading COVID. So right now our capacity is pretty low.
Are you testing for COVID when they go in?
So we're not testing them at a lab, but we test everybody. We take everybody's temperature. We require everybody to wear masks, wash hands, and we're only allowing 1 client in our office at a time. And we've rearranged our office to make sure that we're keeping an adequate spacing from them. And so far, knock on wood, none of our clients have tested positive for COVID.
Good, that's good plan.
Yeah.
Did you have a question, Rita? Rita, I guess she can't hear. She looked like she had a question.
I have a question.
Yeah.
What kind of legal services do you provide your clients?
Yeah, so we don't provide legal advice. None of us are attorneys. So what we mostly help our clients do is we work with them to file orders of protection. So an order of protection is similar to a restraining order, except that an order of protection is specific to either domestic violence, stalking, or sexual assault. And you do not have to have a lawyer to file an order of protection. And so our staff are well trained in filing for those. So we help our clients do that all the time. If they need an attorney, then that's when we work with Tara's shop over at the coalition to get them an attorney who can work with them for they work on a grant, so it doesn't cost the survivor anything to work with those attorneys. And so that's, we work really closely with those attorneys, and then several attorneys in the community. If we, for whatever reason, if the coalition attorneys in the University of Wyoming legal project can't help them, then we will call on Diana's dear husband or somebody else in the community to help for a lower rate. So
could we ask Tara to speak now, and then we'll have questions from both of you, for both of you. Is that all right?
Yes.
Okay, Tara, tell us about your broad scope here. Thank you so much for what you told us. We really I didn't know you were doing that much. Thank you.
Well, good evening, everyone. I'm Tara Muir. I'm the Public Policy Director at the Wyoming Coalition Against Domestic Violence and Sexual Assault. Work with Faryn. She runs a top-notch program. I think Albany County is really lucky to have her and all the advocates that work in her program. And yeah, you're exhausted after you listen to everything they do. So a little bit about me, and then if I can, I'm going to try and share my screen. If there's no magic buttons I have to push except share screen, I would like to just walk you through our website really quickly so that you all will know how to find some of the resources I talk about after we're done. I've been in Wyoming and specifically Laramie for as long as Faryn's been the director of SAFE Project. So I came in early May of 2016. I did very similar work in Omaha right before I came for a good 5 years, just focusing on the big city of Omaha. I'd also worked at the Nebraska Coalition for a number of years, doing some of the same work, policy work, at the state and federal level. But I did do some detours because I think everyone who does this work, we get tired after a while. So I did take a little detour into homeless services, especially those who are chronically homeless, severe mental illnesses, substance use disorders. Tried to help the whole Omaha community figure out how to help people not ping pong back and forth between those kinds of services. So that was really great work to do in the middle of all the different things I do. I get bored after 6 or 7 years. So I think this is my final resting spot, I promise. So I'm gonna see if sharing happens. Nope, host disabled participant screen sharing.
Oh.
I don't know if the host can undo that.
The host has to give you permission.
Right.
The host has to give you permission.
Okay,
Or
if
make
that
her a co-host and then she won't have no problem.
Right. If that happens, somebody let me know.
It says multiple participants can share simultaneously. So is it letting you share?
Let me try it again. Oh, it does look like now it's letting me.
Okay.
There we go.
Oh, I didn't want that to go away. Let me find that again. No, wrong one. Okay. So this is the mission statement of our coalition. It's through a collective voice. We're committed to provide leadership, education, and systems advocacy to advance social change and end violence. Now I'll kind of break that down, but I just want to show you a couple screens real quick so you kind of know. And our members make up of not just Faryn, but we have a Faryn type program in every county in Wyoming, and they're members of our coalition. We also have the UW office Faryn talked about. There is a program now on the Wind River Reservation. And then there's the Warren Air Force Base and another Joint Forces sexual assault program that are also members of ours. So we do our work here at the coalition, really getting a lot of input from across the state, from across these programs. So we're really helping what's happening on the ground in Wyoming, and not just being more of a think tank, although we sort of have that ability as well. So we train, we support, we help all these programs move forward, really help process how to apply for some of those big federal funds. We're clearly not a funder at all. We get our own set of federal funds to help all these programs do training, do networking, do problem solving. And that systems change work is where we really kind of hit the road. Faryn talked a little bit about doing the outreach and doing a lot of healthy relationship training. So one of the public policy things we worked on back in 2018 was to get a state law that told the schools, hey, yes, you can do child sexual abuse prevention training in your school. So, you know, hearing from our programs that some counties, probably not Albany County, but others, were really stuck and weren't able to get into the schools. So we helped pass that law to get all of our counties at least to the table to talk about how could we go to the schools and help with this big piece of prevention. A lot of my work is on the tab Get Involved, and our website's pretty easy, Wyoming DVSA, and DVSA just stands for Domestic Violence Sexual Assault.org. So if you find that, you'll land on us. Under the Get Involved is where all the public policy work I do kind of lives. If you just click on that tab, you can always see our latest summary of the most recent session in the Wyoming legislature. So if you clicked here, this whole list would come up and you could read a snapshot of what we helped support, help drive to get passed, also some of the things we might have helped defeat as well. This whole movie set look to it is what I do usually after the session ends is go around the state and help our local programs either train their board of directors on how to be good board of directors, how to support the mission of the local programs, and also give them an update of what exactly happened in the legislature and help sort of understand their role in politics, their role in shaping change in our state. We are a 501c3, so we don't do election work, but certainly can talk about in an educational way who their legislators are, were they supportive of the things we wanted. If not, please call them. Please have them for coffee, whatever you need to do, twist their arms. So we did a one-time webinar on April 28th. And if you click on this link, it will show you the recording of that whole summary so that everyone could find it. And I wouldn't have to travel the state because no one's doing that, right? The other probably the most important thing, if you're really wanting to keep abreast of new laws, what I'm doing 24/7 when the legislature is in session is printing action alerts, kind of giving you a day-to-day glimpse of what's happening in the legislature. And you can go to this webpage and just click on a link to sign up for my action alerts. When you're in the bowels of the legislature and trying to lobby, I rely so heavily on citizens and our programs to reach out to their elected folks and talk about how they work, how some specific piece of legislation might impact them. A lot of this we can call education, but a lot of it is lobbying, and that's where we step out of our roles as 501c3s and have some unrestricted money to lobby, and we lobby hard sometimes. There's another link if you want to be up to date on what's happening in the United States Congress. That action alert isn't nearly as fun because we all know not a lot gets done in Congress these years, but it's there. And especially Faryn brought up the Violence Against Women Act, and that's one piece of legislation that will really always keep everyone up to date on. That Violence Against Women Act was first passed in '94, and it gets reauthorized every 5 or 6 years, trying to make all the federal laws better and the streams of funding better. So we pay a lot of attention to that. The rest of this page is just fun stuff to scroll through, but it does keep track of all of our previous sessions as well. If you're ever interested in knowing what we worked on in the past, but the action alerts for when the session is going is what I get a lot of enjoyment of bringing my old journalism career to bear, and people stay very much educated there. And that's kind of it. I'm going to stop sharing, except for I want to talk a little bit about the history of our movement, and probably half of you on this call could talk about the history of the battered women and sexual assault survivor movement. But it keeps going through different evolutions. We're not the same thing we were way back in the 60s and 70s when women first started talking about how do we keep women safe? How do we bring them into our own homes? And some of them didn't even say, how do we do it? They just started doing it. The 60s and 70s was immense social change, a lot of social justice work. So that's when our movement started. I think women were always taking care of women. And I say women because that stereotypically was what it was all about back then. But as we've evolved, the 80s brought a lot of structure to shelters, to local communities where they might get some city or county funding to help run a little bit of a house like Faryn has. And then in the 80s, it started going even more forward. You had a woman named Ellen Pence who said, why are we advocates the only ones trying to help people get out of their dangerous situations? Why isn't law enforcement coming to assist us in some of these dangerous situations? I think as Ellen talks about it, she was climbing up the back of a house on a trellis to help a woman get out the back windows so the front neighbors wouldn't see and couldn't tip off the husband to come back from work. And she was afraid of falling. She didn't fall, I don't believe, but she thought a guy with a gun and a badge needs to help out sometimes. And I think the rest of the country was starting to see some of these situations were so dangerous. So back then we started talking about how do we get law enforcement to the table to help? How do we get prosecutors to help? How do we get new laws? And that's when state coalitions started forming. And then fast forward into the 90s, we even had a national organization, National Network to End Domestic Violence. We all pooled our best thinkers together, and ergo came the 1994 Violence Against Women Act to make some domestic violence felonies and federal violations of law, to start talking about how do we keep firearms out of these dangerous relationships. Women are 9 times more likely to die if there's a firearm present. Doesn't mean we're all anti-gun at all, but the research just kept saying how many women are dying and we have to do something about it. Fast forward the next 20 and 30 years, we've really taken on survivors who aren't getting services, who don't feel comfortable coming to what looks like a middle-class white woman shelter. How do we reach out to the immigrant community? How do we reach out to the Spanish-speaking community? LGBTQ populations aren't protected in federal law until the 2013 Violence Against Women Act, when it said, thou shalt not discriminate against people who identify as any of the LGBTQ communities. And then we started hitting hard economic justice. You heard Faryn say a lot of what they do is just help survivors get something to get them back on their feet. And usually that's dollars, right? Transitional housing, which a lot of that program's run from our coalition as well. But all of this is to fast forward to say what we began to learn, and thanks to lots of universities and research and just talking about violence and what are the root causes of it, is oppression. And if we're not trying to start working against all oppression, whether that's because you're a woman, you're oppressed, because you may be from Africa and an immigrant, you're oppressed. We have to try and start working against all those oppressions so that everyone feels comfortable coming forward and getting services, and it's the right thing to do. We can't pit one injustice against the other. We have to all move forward together. So to open it up to something a little bit more exciting, I'm going to go back to our very front page. We released a statement supporting the Black Lives Matter movement. I hope it goes there, yeah. Because we see oppression so intertwined, whether you're Indigenous, you're Black, you're a person of color. Our whole coalition, particularly the staff, have really taken on this call to end all oppressions. It's very hard work, it's very complicated and complex, especially in a state like Wyoming. But I'd love to take questions about that or anything else. It was important to us that we live the philosophy that we've moved through this whole movement and this history of the movement to get to a place where we examine our own privilege and power, and have to talk about racial justice as part of the reasons that so many people are oppressed and will be taken advantage of. So with that, I'll end, and happy to take any questions and pull Faryn into the conversation too.
I would like to, oh, I'm sorry. Am I butting in?
No.
No. And I'll stop sharing my screen.
Oh.
Go right ahead, Henry.
Okay, yeah, I would like to hear your comments on what appears to be a national movement to defund police and replace a lot of their calls with social workers.
I'll start, and then maybe you can jump in too, Faryn. It's too bad that I think the movement coined that phrase, let's defund the police, to help with their public relations, to get attention to the gravity of the situation. There's no question we need police. It says protect and serve off on the side of every police car. But what we've learned over the years is it's disproportionate too often who is arrested for domestic violence. That often if you're a person of color, and this is men and women, you're more likely to get either arrested or charged or end up doing prison time than you are if you were a white person. When our movement decided to turn towards having law enforcement help us, there was quite a debate with women of color in the movement saying, wait, police don't treat us all equally. And our movement felt like we sort of missed a step. We didn't listen enough then. Now, defunding the police also means just reevaluating where we're sinking the most of our dollars. And if Faryn could have a couple of advocates, I'm sure, to go out on a call once law enforcement has secured that call, and they can step away and just have an advocate sit down with a survivor and talk and have money to fund that, how much of a different world we might have. And I'll let Faryn, if you want to jump in, because I could talk on this for a long time.
So overall, I think that I would start by saying that oftentimes I think that people who create movements are really bad at public relations, because I think saying defund the police makes people think that we just want to get rid of people just want to get rid of the cops and don't ever call the police and we don't need police. And in talking to a lot of people in our community who are supportive of that movement, it is what Tara said. It's considering where is all of that money going, and could it be reallocated into programs in the community that help people who have addiction problems or major mental health concerns, so that law enforcement officers aren't always having to be the ones to do that work. Calling it defunding the police, I've always thought was a terrible idea, but I'm not the person that created their movement, so I can't change the name. I will say that Safe Project has a pretty unique experience with law enforcement in comparison to the other nonprofits in the community, because we work so closely with law enforcement, specifically with the Laramie Police Department. And the safety of our clients really depends on a fully funded, well-trained, fully staffed police department, right? Like, we don't want a domestic violence victim having to wait 3 hours for an officer to get to her house because the police department doesn't have enough officers and they're out on other calls. We want the police department to have money for training so that our officers understand how to investigate sexual assault cases, because they are so complex, how to be trauma informed when talking to a victim of domestic violence. And so we really have a unique relationship with the police compared to other nonprofits in the community. the chief and I are pretty good buds. We work pretty closely together. And he and I have talked about, wouldn't it be nice if we could afford to put a satellite office at the police department? So I could hire someone as an advocate and he or she could work right there with the police department and go out on calls with officers. Officers could, make sure that everybody's safe, make sure the offender is either in jail or not there. And then with an officer present, maybe outside, our advocate could speak to the survivor at the house so that she and her children aren't having to be packed up by the cops and taken to the shelter or taken to the police department to meet with an advocate. Because really, officers are there to investigate. They are there to make sure people are safe, and they need to let the survivors talk with someone who can deal with their trauma and who can get them safe. And they want to do that. In Laramie, overwhelmingly, the Laramie Police Department really appreciates advocates. They really appreciate Safe Projects advocates, because us helping with that victim allows that officer to get in there and do what they need to do to investigate what happened and to get that offender behind bars, right? And so while I am supportive of, I'm always supportive of looking at where your funding is going, because I'm a nonprofit director. So I think we need to be putting money where it needs to be. However, I don't necessarily see the local police department as being overfunded, not when it comes to training. I know that they've had to rely on free training from the university, from university professors, to train them on trauma-informed practice. We're really lucky to have Matt Gray in the community. He's a professor of psychology at the university. He's wonderful. And he trained all of their officers on trauma-informed investigations, but he did that for not very much money. He might have even done it for free. And if they had to send all those officers to a national training, it would have cost thousands of dollars, and they just don't have it. So I would like to see more money allocated that could be used for things like that for them. Because that's something they struggle with too. They struggle. And I think that they lose officers to police departments that can pay more. My cousin left Laramie to be a police officer in Denver, and he was making $75,000 a year in Denver as a police officer, as opposed to the $48,000 that they start them out at in Laramie. So I think we have to consider that too when we think about taking money from the police department. Is can we retain good cops who aren't going to leave and go to other places? So there's so much to talk about with that. I can see all sides of it. And it's definitely a very complex discussion, for sure. That's a really long answer. But there's a lot to say with that, for sure.
Could we jump in just a little bit and have you address, if you may, elder abuse in Albany County and in Wyoming in general, and how that is addressed as far as your project is concerned, and what might be done, and where is it found? Is it found in nursing homes? Is it found in personal domestic situation? Could you just give us, is it prevalent? Is it a real problem? And where do we go from here?
So elder abuse is super prevalent. It is a problem. The problem with elder abuse is that it's really hard to see it, because most of the people who victimize vulnerable adults or elders are people that take care of them, and people that are in their own families. And so if somebody outside of that circle isn't privy to what's going on and isn't knowledgeable and doesn't know that something's happening, then nobody really ever finds out. And so, the most common type of elder abuse is financial abuse. People who are being scammed by their grandchildren or their children. And, it's really hard to see that stuff when it's happening. And so we don't work with people in that population as much as I would like to, but it's very difficult for them to seek help because they are so vulnerable, and they really are, they're just at the mercy of the people that are around them who notice things that aren't right. And if somebody doesn't notice, then it doesn't get reported, and then we don't find out about it.
Okay. Do you think there's a real element of that in Wyoming that isn't being addressed?
Oh, sure. I think there's an element of that everywhere. I do. I think that it's probably worse in Wyoming. I think a lot of, crimes involving family violence, including elder abuse, it's harder in rural states for those to be addressed because people are very isolated, right? Like you've got people living out in really tiny communities on ranches. They're not around a ton of people. We don't have big urban areas here. So yeah, I definitely think that it's prevalent in Wyoming, as much so as other states, for sure. Tara might know more about.
How could that be addressed by, maybe saying we're concerned for you, or, because often the older person isn't aware that that's going on.
Yeah. So I think, the best thing you can do probably is, if you have a concern about elder abuse, would be to report it. I think that because that person is the person who's doing it is probably a family member who has control over their finances, you're not going to get anywhere talking to that person saying, hey, Billy, I don't think you should be scamming your grandma and grandpa out of their retirement, because he's not going to listen to you, right? And grandma and grandpa may not really know what they might not understand what you're telling them. And so Adult Protective Services is a wing of the Department of Family Services. And if you ever suspect elder abuse or vulnerable adult abuse, you can always report it to the Adult Protective Services in Albany County, and they can work with local law enforcement and with the Department of Family Services to get to the bottom of it and get that person some help.
Thank you.
Mm-hmm. And I'll just add that there is a group of lawyers who do a lot of the guardianship work, and they've done some looking at these issues, and there are some holes in the laws. And I know they were trying to get some different things passed that I don't think got very far. But they documented, even within Wyoming, exactly what Faryn said, that it's mostly the children or grandchildren. And it is, although everything's very underfunded in Wyoming, Adult Protective Services clearly is. So you may get pretty frustrated if you do try and report, but working closely with a guardian is sometimes the best way to get that vulnerable adult some protection so they can start digging around as well.
Thank you. Going forward, and with the legislature meeting in January, what's on the top of your list relative to what really needs to be addressed right now regarding your program?
Well, all of our programs are already cut 20%. There's probably talk they'll be cut another 20%, if not more, when all is said and done, because as we go into the legislature this year, it's a big budget year. So economic crisis is the headlines, and it is for our programs as well. They're laying off advocates already. They're making adjustments. But at some point, there won't be any services if we keep cutting. So that's number one, to get a little more educated about how to talk to the state about whether it's passing new taxes or where our cuts, best invested. That's what we'll be working on most. I don't think anyone's going to have much time to worry about changing definitions of sexual assault. That's just not going to be on the list, even though God knows we need it. Or immigration issues. It's all about the economy right now. So we're just going to try and tap into that next year.
Other questions?
The reason I asked this question is that I was on the hotline with the SAFE project way back when, like in the 70s, when it was just in its infancy in this county. And I was trained, went through a big training session. Before I did that, I'd be on the line for so many, all night, you know, every so many days, a month, whatever could be worked out. I was wondering about your volunteer program. This county and this community runs on solid, dedicated volunteers. And I'm just wondering if we're tapping all of those people that might be able to be of service that you might find valuable in helping you through all of this that we're going to be going through for the next undefined period of time.
So SAFE Project is fortunate to have, we have the biggest volunteer base in the state because of the university. I used to be the volunteer coordinator at SAFE Project, so I was responsible for training and recruiting all of the volunteers. And I always wanted, you know, I made it my mission to find volunteers in the community who were permanent residents of Albany County, because oftentimes we have volunteers who they're wonderful, but they're UW students, and after a couple of years they move away and we lose them. So we have kind of a high turnover rate with volunteers. So I absolutely would love to tap in more to, you know, men and women in the community who are maybe retired and who are interested in doing some volunteer work. And there's a lot of different types of volunteer work that people can do. So if anyone is ever interested, please let us know, spread the word that we're always looking for volunteers.
Do you have a local website and I've not looked at it, but it could be incorporated if it isn't. Okay.
Yep, we do. It's just safeproject.org.
Okay.
Mm-hmm.
Thank you.
Yeah.
Anybody else have questions they'd like to bring up? I first of all want to thank the work that you're doing. It's remarkable. And I had no idea the extent of what you are doing right here, Faryn, in addition to housing the families. And Tara, I can't imagine you were traveling to all these places. Is that right? All over the state?
You bet.
And what was the significance of some having a larger circle and some having a smaller circle? What did that have anything to do with the number of people in there, or what on your map?
I don't think the size of the circles mean anything, but some of them are just a director and maybe a part-time advocate. And they, you know, in some counties, that's all they have is volunteers. Or they have to send the crisis calls to an answering service, and then that answering service get to them. It's pretty difficult out there in some of the really unpopulated counties, for sure.
How many counties have an actual safe house of some nature like we have here in town?
I should know that, but not all of them for sure, and maybe not even half of them.
Mm.
Some of the movement building and learning we've done over these decades is who the heck wants to pack up their kids, go live in a shelter, rip them out of school, as Faryn was talking about, have to get resettled again, when the problem, don't get me started, but the problem is usually the abuser. So in the 80s, when we kind of created this, why don't we have law enforcement help? Let's make it a crime. Let's have him go sit in jail for the weekend and let mom and the kids or partner and the kids stay in the house, get that advocate to come visit however often they can, to start talking about resources, talking about danger, safety planning, number one. And part of that, and it kind of goes back to the defund the police conversation, because I think Wyoming is sort of missing the boat on a much bigger community response. Not only should the abuser be the one who kind of gets taken out of the house so family can stay safe, stay where they are. We need a lot more community resources and definitely different funding streams to help that abusive person figure out, why the heck are you doing this? whether they need to go to substance abuse, mental health, that's not ever the cause. It's a complicating factor. But they learned that behavior, whether it's from social media, movies, or mom and dad. They learned it, and it's time they unlearn it. So those kids who watched it, and for spouse, partner, to not have to deal with it anymore and get over the trauma. And that's what most survivors will say. Could we just get him to stop? And I think that's kind of what the defund the police movement wants to try and get back to, is how does the community help step in, keep the victims safe, but get the person who's thinking that this is some solution to their problems to break jaws or to strangle or to attempt to kill. And sorry, I know we're at post-dinner time, but the threat of, if you leave me, I'll kill you. If you leave me, I'll take you to court and take your kids, which is the new frontier of abuse, is abusing people in family court. How can the community come together and help that abuser to change their ways? We know they're very talented at lying and doing acting and all of that, but change has happened. And how do we capture that? We can't put it in a pill, but there are intervention groups. There are things that Wyoming, I don't even think, is investing much time into really looking at.
Years ago, SAFE used to have a program for either anger management for the abuser, or there was some real emphasis on that a number of years ago. Is that still happening?
No, so a long time ago, Jane Warren, who helped to incorporate SAFE, they had a batterer intervention program, but SAFE doesn't have a batterer intervention program anymore. There is a batterer intervention in Casper, so they do that there.
And Wind River Reservation has a very culturally specific one to help their tribal members. But as far as I can tell, that's it.
Well, that would be good to be funded again in many places as possible, because I think it helped. Maybe I'm wrong about the result. Maybe it didn't turn out to work as well as they hoped.
It is kind of one of the final frontiers of what works, because we certainly haven't gotten rid of domestic violence yet. Sorry, I think there's a...
This is Patricia.
I've recently been exposed to and watched the movie The 13th, which is it's a documentary. I've just watched it. It has changed my whole thinking on this Black Lives Matter, and I don't mean that derogatorily. It has brought issues into my brain, and I've lived a pretty long time, that I never dreamed was happening in the United States of America. It's on Netflix. If any of you want 100 minutes of really deep information about Black lives, incarcerations on the 13th Amendment, I totally suggest that you watch it. And then after that, the person who did the documentary, I can't pronounce her last name, she spent 2 years doing the documentary. She has an interview with Oprah, and it is dynamite. So I just make that as a suggestion. It has changed my whole thinking,
Patricia had something to say, and she's down below there on the screen. Did you say?
Let Nancy go ahead and talk first. Nancy Lick, let her talk.
Just two things. One is, what strategy is in place on a statewide level, on a policy level, to start pulling the various aspects of the system so they're all rowing in the same direction? Every time I read in the paper of a sentence that a judge has given to a batterer, that, okay, if they finish this drug treatment program, the battering will go away. And when we all know that's not going to happen, that has nothing to do with somebody being a batterer. But what kind of strategy long-term strategy do you have in place for attitude changing, judicial training, and getting all the systems working together?
Oh, let's have a special hour just on
Yeah,
that.
that'd take longer than an hour.
Yeah, but a short story. I mean, it's the bane of my existence to come into Wyoming and just being shocked that there isn't a statewide steering committee. So I've been people run the other way when they see me because it's like, hey, let's start something. You used to have a statewide DOVES thing that was just about batterer intervention programs, and the AG's office should be the leader of this, and they don't want to touch it. And we can talk later, Nancy, because that is what will bring a lot more federal dollars and funding in if we could get everyone to sit down. Wyoming has the issue of local control. And whether it's your county sheriff who's run things forever or the county prosecutor, that's hard, and it's a big fight at the statewide level. They don't want to hurt
Gotcha.
stuff.
Yeah, I was one of the people who read the federal applications for the feds as a consultant in the 90s. And
Awesome.
I'm from very tiny little towns out west to, you know, $15 million requests from Boston, Massachusetts, you know, everything in between. Another question is a personal one of you, Tara, which is before you went took your break and went into homeless issues, what kind of work did you do in domestic violence? What kind of agencies did you work for?
You know, I didn't do domestic violence work before. Well, I did it from 2000 to 2006, and it was right after law school that I realized, yeah, this system's rigged for everybody, particularly women.
Okay.
And so I did Nebraska Coalition policy work from 2000, 2006. That's when I took the break. And then the last 5 years before I moved here, I focused in just on one city, thinking that would be easier.
I would also suggest that you add to your description of the history, Ambassador Annenberg in the 70s and what he did. And thank God for the burning bed and a few other things.
Yes.
Yeah.
Thank
But
you.
Annenberg spent millions to get the issue out in the 70s.
Okay.
How about Patricia? She didn't get to speak.
Thanks, Nancy. Thanks. My name's Patricia. My concern, one of my concerns is with the elderly, where their medical condition, they have family maybe, and maybe they don't, but I ran into situations where they weren't getting the proper guidance. And so the kids were either afraid or held back, or they didn't understand quite how to handle it. The older person really needed a lot more guidance. She needed an advocate. So to check medications, to see what treatments, I ran into several cases like that. I'm wondering if we have anything like that connected with the medical facility here or in the community that where there are advocates that help people like that.
So I'm not as privy to what the medical community here looks like. I do know that it can be really frustrating to get help for an elderly person who isn't getting the medical care that they need, because people have the right to refuse care. And if a person is of sound mind and is competent, then they don't have to live a certain way. They don't have to live in a clean house, or they don't have to take their medicine, or they don't have to go to the doctor. And so a lot of people get really frustrated with their parents, you know, for an example, because they don't want to go to the doctor, and they don't want to take their blood pressure medication, and they don't want to, you know, they don't want to have their kitchen full of, you know, healthy food, and all they do is eat Tootsie Rolls, and they have diabetes and all these things. And you know, it's really hard to, if that person is of sound mind and is competent, then you can't really do anything about that, unfortunately. But if they're not, you know, if somebody is struggling with dementia or something like that, then that's where adult protective services can come in and really advocate for them and get them support.
Most of the people I've worked with have been healthy in mind.
Yeah.
And they've reached out to me and said, my kids don't understand. I've been to the medical facility. They treat me like I'm an old person.
Yeah.
They don't really listen to me. And so I got the feeling like, my gosh, there should be a place for some kind of advocate, at least offered to a person like that. You'd have to develop a rapport, a relationship, so they could trust you. But,
Yeah, and I think that, you know, I see that a lot with people who live in poverty, going
Yeah.
to medical providers.
Yeah.
You know, I think anybody who does like social work or human services work in any community probably knows which physicians they would send their clients to and which they would probably tell them not to go to. And I think it's similar to what you're talking about. You know, they go to someone who just disregards what they're saying and thinks
Mhm.
they don't know what they're talking about. They don't know what they
They
need.
get frustrated with
Yeah,
that
they're
medical
uneducated.
person in
Yeah,
particular.
and so I think, you know, it, and I don't know, you know, if there are doctors, and I tend to know more doctors who specialize in women's health, right?
Mhm.
Because
Yeah.
of the population I work with, but I don't know if there are doctors in the community who, you know, are especially sensitive to working with an elderly population and would be somewhere to start. I think that's probably what I would recommend, but I'm sure you have thought of that.
Do you or Tara know of what they do to train folks at Ivinson to deal with elderly people
I
in their
don't
care?
I don't know that. I'm
Because
not
I've
sure.
had, personally, I've had complaints from elderly people to me,
Yeah,
asking me to advocate for them.
yeah,
So,
yeah. That's
mm,
not a surprise to hear that.
okay.
This is a
Nancy,
chronic,
yeah.
yeah, this is a chronic problem. The last 5 years, I've been the volunteer social worker at the downtown clinic. And there's been a bunch of folks at the, you know, in the 50s who were not super
Mhm.
elderly, who really needed that kind of assistance. And you have to work very hard to find it and get it.
Yeah.
But what always broke our hearts is that once they're become eligible for Medicare, they're no
Mhm.
longer eligible for clinic services. And it breaks their
Yeah.
hearts. They're sobbing as they go out the door because what Faryn just said about the trust element is
Oh,
critical. And they trust the clinic. Someone had been going there for 10, 15 years since the clinic started.
Mm.
And the clinic has a list of doctors that are simpatico with the clinic's objectives, that they refer folks to.
mhm.
But most of them take a long time to end ties. And they show up on almost a weekly basis just to say hi and have a cup of coffee.
Mm.
And,
Wow.
you know,
Wow.
yeah, but again, it's the frontline folks in places like the clinic who go beyond just, oh, you have the flu, here's your pill,
Right. Right.
that really identify these folks.
Mm.
And
I
it's
think
not, you know,
I think Patricia, if I know the clinical coordinator of the emergency room really well. Her name is Erin Rumsey.
Mhm.
And if you ever hear of anyone having like a negative experience or concerns with emergency room staff at the hospital, I think it's worthwhile to reach out to her and talk to her about that.
Okay.
Because she really cares about people and about patients. And I think that she would want to know those things and provide more training to her nurses if that's a concern at the hospital, at the emergency room.
Yeah, and it's not just the emergency room, it's up on the wards too. But
Yeah.
I've experienced that with people, so.
Yeah, I'm not surprised to hear that.
My one last question is, I'm used to live in Rochester, Minnesota. We had a Y resource center that dealt with battered women, so we ran groups. We had 2 or 3 groups, really good. And ladies did have to escape, like you or somebody, I think it was Tara, had a story. They did have to escape to get to that group. So it was on their life, you know, they did that.
Yeah.
So I guess we don't have anything like that here. Nancy was trying to bring that up.
So we do have support groups here. We have a sexual assault support group and a domestic violence support group at the university. You don't have to be a student to participate in those groups, and they're free. So I'm not sure if, you know, a non-traditional, like not a young person, I'm not sure if like a 50-year-old woman would feel comfortable going to a support group on campus with maybe a lot of younger student age people, but that is available on campus, and I've heard really positive things about the groups.
Okay, that's good. That's good.
Yeah.
Just need something.
Safe Project used to run a support group when I was a new advocate, and it was not, you should never run a support group without a mental health professional in charge.
Oh,
and because
definitely.
and because we don't employ a counselor, as a licensed counselor, we don't provide counseling services. It was not a great situation. So that's why we've kind of let those folks handle that, and we do what we do, but we always try to refer as much as possible.
Yeah, I was a community counselor
I
there.
want to thank you very, very much. I'm going to pop off now. I have to tune into the convention. I got to get them all. So I want to thank you very much for letting me join you this evening. And I look forward to seeing you in person one of these days. Thank you very much.
Thanks for joining us, Jermaine.
Well, does anyone else have?
Patricia, did you have, well, I was just going to say, was Patricia in the middle of a thought there?
Oh, no, I was just following up with, I was a community counselor.
Yeah.
So I
You
totally agree
understand,
with Faryn that you need a mental health worker.
Yeah.
There, at least one. Yeah.
Mhm.
Thank you, Faryn.
Yeah, thank you.
And
Well, this
Tara.
has been so informative, and I love knowing that we could go to the, was it your web page that you showed us, Tara?
Yep,
Yeah.
WyomingDVSA.org.
Oh, because, and I don't know if either of you need volunteers, but a bunch of us are old counselors and social workers. And
We would
people
love
that are-
to have you. So
people that are very interested in all that you are doing. And,
we would love to have you.
and I think Patricia's idea is that we probably need to get a whole cadre of people of all ages to be the person that goes to the doctor's appointment with each of our friends, so that there's a second pair of ears listening and a second person caring for what's going on. So I think there's a lot of opportunity for people to help each other.
Yeah.
And you have been so wonderful to take time from your busy lives. I know it's hard to even get a hold of you, and there you are working like beavers every day and every minute. So thank you for being on our panel and bringing us so much information. I'll let others speak now. Anybody else?
Thank you. That was so informative. I'm really grateful for the great web pages and history and what's going on here in town. Thank you so much for all you do.
Thank you.
Thank you guys. Thank you for having us. We appreciate any opportunity we have to talk to people. So
Yeah.
we're happy.
Someone's interested. Yay.
Many, many thanks. We appreciate that. So,
And I'd like to thank Diana and Nancy for arranging to have Tara and Faryn with us, and creating the flyer and inviting folks. So thanks so much for your work on that. Any other quick questions or anything that anyone didn't get in? No? Okay. Well, Tara and Faryn, thank you so very much for the work that you do. Very important work that you do. It's certainly appreciated by this group, and is appreciated by many that don't realize all that you're doing. And so thanks so much. And for sharing opportunities for us to get more involved, whether it's paying attention when the legislature is in session, and that you keep people informed of how to support what's going on, or other ways to connect here in town with the work that SAFE is doing. So thanks so much. We really appreciate it.
Thank you guys so much.
Thank you.
Thank you.
And thank all for tuning in tonight. It's great to see you all and great to have some guests. Thanks for joining us. And when I figure out how we access the recording, I will let you know.
Stay safe, everybody.
Bye.
See ya.
Bye, and thank you so
Thank
much.
you.
Good to see your faces.
Have a good night.
Night. Good night. Yeah, let's see. Yay.